Citizenship started for me and my colleagues, and are thinking about it and practicing it and studying it. It started in 1994. I was hired to run the homeless outreach team for the Connecticut Mental Health Center in New Haven. Outreach work involves going out onto the streets, going out looking for people who in many cases don't want to be found, and doing this within integrated systems of care, with the principle of going slowly at the person's pace, emphasizing the person's strengths, not their weaknesses, making contact with the person first, not the patient. And this was the greatest work in the world. I loved it. So I started thinking, well, these encounters that are taking place out on the street, they're clinical encounters in a certain sense. But they're more than that, too. They're personal encounters. They're social encounters. And as social encounters, they're encounters that are taking place at the boundaries of society, at the psychological boundaries, the social boundaries, even the geographical boundaries as far as where people usually reside. And so I started thinking of that. And then I started thinking about identity. We could provide all these instrumental or practical services, but what about the affective or symbolic or feeling services? What about identity? It just it was there for me. Where are people going after they receive the services that we can offer them? And then there was a man named Jim came along, and Jim came to epitomize everything that worked about outreach work. And then Jim came to epitomize everything that didn't work about outreach work. And then Jim inspired this notion of citizenship. Jim was in his late 50s, and he had grown up in a rural area outside of Pittsburgh. A large extended family, a large family, pretty close-knit nuclear family. When he was about 17 or 18, it was discovered that he had an inappropriate relationship with a younger female cousin. And he was basically excommunicated from the family. And he joined the Army. He earned an honorable discharge. He started roaming the East Coast, getting odd jobs, menial jobs like washing dishes or cleaning floors and things like that, losing them because of his odd behavior and his drinking. At some point along the line, and again, this is something we learned much later, he was diagnosed with schizophrenia. And about a year before we first met Jim, he came to the New Haven area and to a town outside of New Haven. He had made contact with his sister, from whom he'd been estranged for many years, maybe something like 40 years. But she was living in the New Haven area, and she said, "You can come and live with me." And he stayed there for about a month, and then she had to ask him to leave because of his odd behavior and his drinking. And so he came to New Haven, and he had been sleeping on the ledge of a highway bridge. Highway bridges over roads. On the roads underneath, you have embankments on each side, and at the top, there's a level space that's parallel to the highway above you, maybe 6 feet, maybe 5 feet, something like that. And on that ledge, people would sometimes sleep, and often groups of people. And one of the outreach teams came by, and they saw what looked to them like a new person, and probably a man, because as far as we knew at that point, we had not met any women who were sleeping on highway ledges, sleeping lots of other places, but not there. So it was assumed that this was a man under about a dozen blankets. This was late fall, and it was a cold late fall, with neon yellow sneakers sticking out at the end of the blankets, and his head was covered. And they said, well, let's go on the rest of our early morning outreach run, and we'll come back at the end of it, and we'll see if we can meet this gentleman, likely gentleman. And they came back around 7 o'clock. He was gone. This happened a few times. Each time they didn't want to wake him. They'll come back. He was gone. They started asking around at the soup kitchens and shelters and other places, asking people who were homeless, you know of anyone who is homeless and he sleeps under a highway bridge and wears neon yellow sneakers? And finally, the director of one of the soup kitchens said, "That sounds like Jim. Try the library." And so they went to the New Haven Public Library, the main branch of the library in New Haven, a historic old library that looks onto the New Haven Green, where people, and this was 1994, 1995, who were homeless could come in during the day and they would sit at a table, they'd get a book, they'd prop it open in front of them, they'd put a chin on their hand and fall asleep, and no one bothered them. So the outreach workers came to the library and they tried to act nonchalant while they were bent over, looking under tables, looking for neon yellow sneakers, and they finally found the neon yellow sneakers and Jim. Jim was not looking to be found. Jim had incredible skill at parrying any approach from outreach workers. In any case, he said he was too old, he didn't need any help wouldn't help him anyway, and they should just leave him alone. One of our outreach workers in particular slowly was able to make contact with Jim. He was a peer worker, person with lived experience. And in addition to following all the rules of outreach, including the golden rule of don't make promises you can't keep and keep all the promises you make, he learned a couple of important things about Jim. One is that he learned that out on the street, people were always asking him for things. A cigarette, $1, a pair of socks, half of his meal, or whatever it might be. So Ron said, "I'm always going to have something to offer Jim," or take him for a meal if he was willing to come, things like that. The other thing that he noticed is you don't try to talk to Jim before he's eaten, because he'll be grouchy. Ron developed a relationship with Jim slowly. Jim continued to say, "I don't deserve any help." Ron began to piece his story together. And over a period of time, about a year, Ron persuaded Jim to apply for SSI entitlement funds, and he was awarded SSI. He persuaded Jim to talk to the team psychiatrist, who prescribed some medications for Jim that Jim took when he felt like it and didn't when he didn't feel like it. And over time, and this was really the one that the answer was an absolute no. They did not want housing. But over time, Ron was able to persuade Jim to take a look at some possible houses. And there was supportive housing that was available through HUD that we had access to. Finally, the big day, Jim moved into his apartment, and this was a day of celebration for the team, for Jim, for Ron, for the team as a whole, because now we knew that if we could help someone like Jim get into housing and get the services that he was getting, we could do anything. The sky was the limit. 2 weeks later, Ron came into our team meeting not looking too happy. And when it came his turn to talk about the people that he was working with, he said, "Jim told me that he wants to go live on the street again." And we are, why? Why would he want to do that? Well, Jim said, "I know people out there. They respect me. He didn't quite put it this way, but he had a certain status as someone who could survive homelessness. Here, what did he have? Yes, he had an apartment. He didn't really know how to cook and things like that, so that was part of it. He was having mental health symptoms. The TV was talking to him even when it was off and even when it was then unplugged. But it wasn't just his mental health symptoms, and in fact, There's research that's showing that it's not always the mental health difficulties that are causing the isolation that leads to sort of the downward spiral, but the isolation itself can encourage the symptoms that then, go through their cycle. But it was also socially. People looked at him funny. He didn't belong there. He didn't feel that he belonged. He wanted to live out on the streets again. That was a very difficult day for the team. It was a very difficult day for me because I thought the whole thing had just fallen apart. And in Jim's case, it turned out so we realized, well, gee, so Ron gets Jim housed, and then he's back out on the street again, finding other people and helping them, get services, and he hasn't had much contact with Jim. And so, okay, Ron, why don't you, spend a little more time with Jim? Let's see if that helps. And it did help. So it helped get Jim over the hump, but we could not do everything. And I started thinking about, I guess the term citizenship started going through my head, and I started thinking, we can offer people program citizenship. That's what we can offer. We can offer them membership in the mental health system of care. But what we can't offer them is what we can't help them do is to help them become neighbors, community members, and citizens. So that's where citizenship started for me.